Now this videocast will be focusing on prescription-only medicines, the supply, labelling, dispensing, everything, all the activities around those medicines. Now firstly, we're just going to look at some medicines that have been reclassified from prescription-only medicines to P medicines. There have been some recent ones such as Orlistat, which is something that is used for people with high BMI and having problems losing weight. Another one is azithromycin, which is an antibiotic, and also we have omeprazole, which is a proton pump inhibitor. Now, when these reclassifications take place, the Royal Pharmaceutical Society, as well as those companies actually holding the marketing authorizations for those medications, issue training, documentation around the sale of those medicines without a prescription. So generally you will have a Royal Pharmaceutical Society guidance on how to supply those medications and against what criteria. Now, prescription-only medicines can only be supplied by retail via prescription by an appropriate practitioner. There isn't a legal requirement that the prescriptions have to be written in English. So if they're not, then you as a dispensing pharmacist may have to source a translator to be able to dispense what's on the prescription, or also to check whether it's legal and valid. Now, European prescriptions, we can also dispense these within the UK. However, we do need to check the prescriber status. We do need the registration number of that person who is actually prescribing it. So whether that be the GMC number or GDC number or NMC number, whichever number that is actually appropriate to that practitioner who is actually prescribing that medicine. The medicinal product that's being prescribed needs to have a UK marketing authorization to allow you to dispense it. With such prescriptions, you may actually need to refer to a UK registered prescriber to ensure that if you are to dispense it, it would be a valid and legal act. Now, the actual prescriptions, so the piece of paper that you get issued with at the pharmacy, there are specific requirements about these to allow you to dispense against them. Firstly, the signature of the prescriber down close to the bottom. It needs to be an indelible ink, or it can be an electronic signature. You need to have the address of the prescriber, the date of the prescription when it was issued. It needs to be valid also for 6 months. The prescriber's particulars, so what type of prescriber that person is. The details of the patient, so you need to have their name, address. If that patient is under 12, you need to either have their age or their date of birth. The medicinal product details are not a legal requirement, but obviously it needs to be there to allow you to dispense something. Now that is in accordance with the requirements for an NHS prescription. Prescriptions can also be written privately. There isn't a standard format for those, but there are, again, specific requirements that need to appear on those. Private prescriptions can be issued for any medication except those medications that are registered as controlled drugs in Schedule 2 and 3. They can be repeatable as indicated by the prescriber. If the number isn't stated, then they can only be repeated the once. Oral contraception can be repeated 5 times, as long as it says repeatable. Supplies of those repeats can be from different pharmacies, and the first dispensing of a repeatable prescription must be within 6 months. Now, the details of a private prescription again includes the patient details, the prescriber details, the date, the prescriber's signature, and then you would have the medicinal details there as well. Now, records that need to be made, so private prescriptions themselves, they need to be kept for 2 days from the date of sale and supply. If it's a repeatable private prescription, then on that last dispensing, then that last pharmacy needs to keep that prescription for 2 years. Where dispensing has occurred and you have to give the prescription back because it says repeatable and the patient can go elsewhere for the next repeat, you are expected to make a copy of the prescription to ensure you have complete records. Also, you need to make a record in the POM register. That can be in electronic form or written form. That POM register itself needs to be kept for 2 years from the date of its last entry. The entry for any date, for any sale of supply, it needs to be undertaken on that day that the sale and supply was made, or on the following day. Within that record, you need to have the supply date, the prescription date, the medicine details, the prescriber details, the patient details. Now for prescriptions, so NHS prescriptions, you can have dental prescriptions, and dentists can only prescribe on those forms for products that are actually listed in the dental formulary within the B&F. Okay, so there is the dental formulary within the B&F. Community practitioner nurse prescribers. Those that are on the professional register, they can also prescribe from a specific formulary. Nurse prescribers also prescribe from a formulary. Optometrist independent prescribers, they can prescribe for ocular conditions and any conditions really surrounding the eye. Then there's something called a signed order for patients. Now you can supply certain POMs direct to patients in accordance with a signed order from an optometrist or podiatrist. So they're similar to a prescription, and again you need to make a record in the POM register. So repeat dispensing, an NHS repeatable prescription, you need to have a whole batch of prescriptions in order to dispense these prescriptions. So you'll have the original, the top one, and then a batch which indicate the repeats that can be made. So the first time a dispensing needs to be undertaken is within 6 months of the actual batch being issued. Subsequently, for up to a year of being written or of the expiry date, you can continue to repeat dispensing. Batch issues that are not signed, they can only be used for reimbursement. Okay, they can't be used as prescriptions. So if nothing is signed, then they can't be used as a prescription. They can only be used for reimbursement back to the pricing authority to ensure that you get paid for the medicines. Before each dispensing, a pharmacist must ensure that the patient is taking and using the medicine and the actual appliance or formulation is appropriate. You need to ask whether there have been any side effects and whether that needs to be reviewed. You need to ensure that there hasn't been any change to the therapy that patient is having. And also you need to ask whether there have been any other changes to the patient's health that should be reviewed before you give them the next repeat medication. The record of dispensing needs to be made in the patient's record, so you need to have the dates and quantities of medicines and appliance that has been given out on each occasion. And if there have been any clinical significant issues, you need to inform the prescriber. Now, repeat dispensing, as I said, you would have a top form, so that's the repeat authorization, and you don't dispense against that one. That can be used for reimbursement. And then you would have a repeat dispensing, and that's the RD form. And on the side, you will have a number at the bottom which will show what issue that is of a batch. So it's against the RD, the repeat dispensing forms, that you actually can dispense. And it is on those occasions where you would go through that checklist with the patient, whether they've got any side effects, whether they have had any therapies changed or anything like that. Now, once you've actually dispensed the product, we will have to consider the labelling of the containers and the packaging. So we've looked at this in a previous podcast. So I'm just going to go through it briefly again. So the labels, they need to be legible, comprehensible and indelible. English only, or if there is any other language on there, you need to make sure that they have the English instructions as well, English details. Essential information on the labels. So you would need the name of the medicinal product, the strength and pharmaceutical form. If it's intended for babies, children or adults, that needs to be stipulated. It needs to have up to 3 activity substances with the common name of each of those actually on the label. A list of all excipients, the method and if necessary the route of administration if that's not clear, the space for the prescribed dose, a statement that the product must be stored out of reach and sight of children, any special warnings, the expiry date, storage requirements, disposal requirements, name and address of holder of marketing authorization, the marketing authorization number, the manufacturer's batch number, and if it's not a POM, then it needs to have the instructions for use. For blister packs, so the actual strips, that needs to have the name of the medicinal product, the strength and pharmaceutical form, whether it's intended for babies, children and adults, up to 3 activity substances with the common name of each, the expiry date and the name of the holder of the marketing authorization. So here you've got a sample label of a dispensed medicine. So you've got the details of the medication, the name, the strength, the quantity and the form. You will have the instructions, you have the patient name, the date of dispensing, where it's been dispensed of, and that statement of keeping out of reach and sight of children. If there are any precautions for use, that needs to be on the label as a legal requirement, so any BNF warnings, any pharmaceutical warnings. And those BNF warnings are in Appendix 3 of the BNF, so you can have a check of those. Now, where a container also has an outer package, for example an inhaler, the container does not need to be labelled if it's enclosed in a package which is labelled with the required details. But really the best practice is to have it on the container and the outer package, so that if the patient throws away the container, then they will retain all the information on the actual medicine. Patient information leaflets, again, has been covered in a previous video cast, so they also need to be legible, clear, easy to use. Because it's going to be read by a patient, usually they are developed with a patient or consultation with a target group of patients. They will have all of the legal requirements of a PIL, which again has been covered previously. So you'll have the therapeutic group or type of product, a therapeutic indication, any contraindications, precautions for use, if there's been any interactions with other medications or other substances, if it has any special warnings. You'll also have a list of excipients, and then you'll have instructions for proper use, such as dosage, method of administration and frequency of administration. If there have been any symptoms of overdose and any actions that should be taken as a consequence, what to do if 1 or more doses are missed, the duration of treatment if this is limited, and a requirement to consult a doctor or pharmacist for further information on the product. Further things include storage, so how you would store the medication, the expiry date of the leaflet or when it was last revised. You'll have also a full comprehensive list of the composition, so the excipients. An additional patient safety label could be a black triangle. So where medicines have a black triangle drug, really it's alerting the healthcare professional that these medicines are still requiring vigilant reporting of any unwanted side effects via the internet or various other formats of pharmacovigilance, because it's still the safety of the medicine is still being monitored. Now, within your dispensing seminars, you will obviously see prescriptions, various types of prescriptions. You will see the different details that are required on NHS prescriptions, private prescriptions, controlled drug prescriptions. Sorry, and you will see how to undertake the dispensing process. So you will get to become more familiar with how to check for those requirements as well. You will also label medicines, so you will get to see what is required on a prescription. You will also see patient information leaflets, so again be able to review what kind of information is on there and ensure that all of the legal requirements are adhered to. And just for interest, flicking through the BNF, you'll be able to see the information that's displayed there about medications that should be replicated on a PIL, and also the black triangle labels that should also be within the BNF, where medicines have been highlighted as still being required for regular monitoring for adverse side effects. So all of this information you will either see within your dispensing seminars or on a regular basis as you start to use your BNF more and more within patient cases and looking up medicines, context of patient diseases and conditions.